Nunavut is home to just under 40,000 people, scattered across an Arctic landscape the size of Western Europe. Most are Indigenous Inuit, and they live in precarious conditions. Few jobs, expensive housing, and by the standards of a rich country like Canada, minimal health services. In the remote hamlet of Igloolik, north of Hudson's Bay, there's only a 4-bed health center to serve 2,000 people.
We have a health system that is already at capacity, beyond capacity, really, and that it can't really burden much more. And then so when something like this comes to play, it really puts those things to perspective.
Even in the territory's largest town, Iqaluit, there are just 7 ventilators in the most basic of hospitals. Proper intensive care can only be accessed after a 3-hour flight south to the Canadian capital, Ottawa. The people of Nunavut are also far more likely than other Canadians to have pre-existing medical conditions that are aggravated by COVID-19.
So higher levels of diabetes, chronic lung disease, COPD, chronic obstructive lung disease. Given coronavirus tends to target those people with underlying health conditions, it's very concerning.
So Nunavut has effectively gone into its own version of social isolation. No casual outside visits are allowed. Returning residents can only come home after they've quarantined for 2 weeks. Travel between communities is only permitted for medical or other emergencies. Even a low number of COVID-19 cases would be catastrophic up here. That's why there's a lot of local support for isolating the entire territory.
It's not an easy position to be in, so I'm very happy with the leadership that we've seen on that level. It's the federal government that needs to step up and assist Nunavut and provide the basic human rights that everybody deserves in the territory.
Even before this pandemic and the near shutdown of the global economy, Nunavut had lower life expectancies and higher rates of poverty than most of Canada. Remote and cut off at the best of times, this is a land that's hoping that COVID-19 leaves them alone with their existing problems, even as it ravages the rest of the world.